Welcome back to this video series on using technology in healthcare. In this particular video we're going to be talking about how to assess vital signs, specifically your patient's pulse, but pretending and using our mannequin. Before we think about how we can assess our mannequin's pulse, we need to actually understand what a pulse is. So when our heart contracts, we know that it sends blood around the body, and you can feel that contraction within the arteries. So as the blood is pumped through, the arteries will also have a flow of blood going through them. So you can palpate that, that's the fancy word for feel, using your fingers. So we usually use our first and second fingers, and the most common place that you would feel for someone's pulse is in their radial artery. So the radial artery is here. Now you can practice feeling that on yourself, so it's helpful if you follow your thumb down, you can feel that there's a pulse at the base of your wrist near your thumb. Now you have to be careful when you're feeling someone's pulse not to press too hard and not to press too softly, and that's why we need to practice it, because like anything, it's a skill and it does require time and effort to become competent at it. So you'll notice if you press on yourself that if you press too hard or you go too softly, you can't feel anything, and it is exactly the same on the mannequins. So I know that this mannequin has got a radial pulse and I can feel it just here. If I press too hard, I stop being able to feel anything, and the reason for that is because I've compressed that artery, so I can no longer feel the blood flowing through it. And if I press too softly, I simply haven't pressed far enough down to be able to feel it. So we've got a number of different arteries on the mannequin. So I'm going to start from the bottom and work our way up. On our feet, we do have many pulses, but the one that you'll be able to feel on the mannequin is the pedal pulse. It's just here on the top of the foot, and I can feel that very easily there. One of the other common pulse points that we have on the body is the femoral artery. So in the groin, you can palpate a femoral pulse. Now it's very difficult actually to feel on the mannequin, but again, it's very good practice for you to have to practice feeling for an artery, because in the real world, when we are palpating our patient's pulses, particularly if a patient is unwell, you might not be able to feel their pulse very easily, especially if the patient is very acutely unwell, because they may deteriorate to the point where you can't actually palpate peripheral pulses, the ones that are further away from the centre of their body. So we've got femoral pulses on the mannequin, and then we have got the radial, as I've already mentioned. We have one that simulates the brachial artery, but it's higher up than you would normally have to palpate it on an adult, but it is on the inner arm on the mannequin. Again, I can feel that. And then finally we've got the carotid, which again is a little bit tricky to find on the mannequin, where it wouldn't usually be in a healthy adult patient. So what we can do as an educator is we can actually change the settings on the mannequin so that we can change the pulse rate, so the heart rate, and we can change the other qualities of the pulse. So for example, if I change the settings on here, so for example on here, when I'm looking at heart rate, I can actually control the patient's heart rate. So I could move it all the way up to 200, for example. Now if I do that, and then I palpate the patient's pulse, it is incredibly rapid. Now what I can also do is I can look at the rhythm. So if we look here at the sinus, they're in sinus rhythm at the moment, which is what we would want our patients to be in. I could put our patient into a number of different types of rhythms, but I would like to put them into atrial fibrillation, which is where the atria of the heart are not beating effectively and often not regularly. So if I put them into atrial fibrillation, again, I can keep it nice and quick, and what we will find then is that the patient's heart rate is rapid, but it is irregular, which is a concern. So if you notice that when you're doing somebody's observations, you would need to highlight that to whoever it is that you're working with on that particular day, and if you're in a simulated learning environment, you would need to highlight that to your educator. So we've changed the rate, and we've changed it to be an atrial fibrillation. If I put it back into sinus rhythm, So we're into a nice, normal, healthy heart rate. But I change it down to 20. And maybe I'm also going to make their blood pressure really low as well. So I'm making this patient very, 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 very poorly now. 79/50. Now you can see on this diagram, I've done that. And what that's done is it's now ignoring the peripheral pulses. So the peripheral pulses are now absent, and you would only be able to palpate the pulses in the femoral artery and the carotid artery. So that's these ones here and here. That was a little quick summary of using the mannequins to assess your patient's pulse, and thank you for watching.